Hello everyone, welcome back to my channel. We are continuing with the histology series. So before you view this session, I would like you all to see the previous two sessions on epithelium where we have described the epithelium, the main functions in general, and we have started with the simple epithelium or unilaminar epithelium, and the session just before this I have covered the simple squamous epithelium, and in this session we will be dealing with the rest of the simple or unilaminar epithelia, that is simple cuboidal, simple columnar, pseudostratified and sensory epithelium. So we will be seeing it one by one. First we will be seeing simple cuboidal epithelium. Simple cuboidal means they are cuboid in shape. These shapes we actually, when we say simple cuboidal, simple columnar and all, this is according to the shape which you see from the side. That means if you take a cell, if you take a vertical section and if you are looking from the side, that is the shape with which we refer this epithelium. That is, if you say this as simple cuboidal, if you look from the side, we can see that it is almost in the shape of a cube. That means all the sides are of equal length and you have the nucleus in the center. But the same thing, even if it is cuboidal, columnar and all, if you look from above you, all these cells will be arranged tightly so that it will again look like a polygonal. So if you look from above, you won't be able to make out which type of epithelium it is. So it is in the vertical section, and when you look from the side, you say whether it is cuboidal, columnar and all. So in cuboidal, you can see that the height of the cell as well as the width of the cell are almost the same, and you have the nucleus in the center, and these cells are resting on the basement membrane. So where will you get this type of cuboidal epithelium? You will be getting it in lining the thyroid follicles. Germinal epithelium, again the surface epithelium of the ovary. You call it as germinal epithelium, again it is cuboidal. And the inner surface of the lens. So the lens, you have the outer and inner surface. So inner surface of the lens, again you get cuboidal epithelium. Now, there are mainly two entities which you usually come across, and it's a doubtful thing for the students. One is microvilli and the other one is cilia. So I would like you all to clear the concept of these two. So microvilli means if you have a cell like this, the topmost region is actually folded, having minor folds, so that it will increase the surface area. So such type of foldings of the membrane on the surface, you call it as microvilli, finger-like projections. But if you have a cell like this and if you have some hair-like projections, which is mainly for the mobility, in order to move the substances coming on the surface mainly, they are known as cilia. They are hair-like projections. So these two differences, what do you mean by microvilli, what do you mean by cilia, their functions are also different. So microvilli is nothing but the cell membrane itself is having minor, very minute foldings, which is very difficult to see under a normal microscope or a low power microscope. But cilia, they are hair-like projections, and this you can make out in a low power or high power microscope. Okay, so that is very important. And microvilli, it increases the surface area so that there will be more and more absorption, and cilia is mainly for mobility purpose. So if you have cuboidal cells with microvilli, it is mainly for increasing the absorption. And where will you get it? It is said to be brush bordered cuboidal cells, which you get in the proximal convoluted tubule of the kidney. And brush bordered and striated, these are the two terminologies which they use when they describe about the arrangement of the microvilli. So striated means they tend to say that they are arranged in a regular fashion, whereas brush bordered means they are arranged irregularly in different directions. So brush means you can just imagine our brush, the daily using brush. It will be, the fibers will be definitely in different directions. So that is how I used to remember. So striated means they are of regular fashion, regularly arranged microvilli, whereas brush bordered, they are irregularly arranged. So brush bordered cuboidal cells you get in the proximal convoluted tubule of the kidney. Now moving on to the simple columnar epithelium. Simple columnar epithelium, if you look from the side, from above, it's just the same as that of the cuboidal. But when you look from the side, simple columnar, you can see that the height of the cell is more compared to the width of the cell. And you can see that the nucleus is not in the center, it is more towards the base and it's almost vertically elongated. And again, the simple columnar is further classified depending upon whether it is having some specializations on the surface or not. So if there is no specialization seen on the surface, you call it as simple columnar epithelium, which you will be getting on the stomach, large intestine and all. If it is having cilia, then you call it as ciliated columnar, which you will be getting in the respiratory tract, uterus, uterine tubes and also you can see hair-like projections. Okay, so simple columnar usually you get in the stomach, whereas ciliated columnar, the hair-like projections, you get in the respiratory tract where you have to move the foreign bodies coming on the surface, uterus and the uterine tubes in order to propel the ovum into the uterine cavity and all. Then microvilli we have already mentioned, when the surface is actually folded in order to increase the surface area. So that is what is meant by microvilli. If it is regularly arranged, you call it as striated, and that you get in the small intestine. If it is brush bordered in different directions, you get it in gallbladder. All these intestine, gallbladder, they are further detailed features and all, we will be discussing it in the coming sessions. For the time being, you just remember examples where you get these type of specializations. Then at some places, this columnar cell itself will be modified as a secretory cell. For example, in stomach and intestine, some of the cells will be secreting, and such cells you call it as goblet cells. Why? Because its secretion will be accumulated on the surface or on the upper part of the cell. So what happens? This part will just bulge in order to accumulate the secretion, whereas the lower part will be narrow. And ultimately the upper part will rupture and pour out the secretion. So this shape is in the form of a goblet. Hence these cells are known as goblet cells. So secretory cells which you get in the stomach and intestine. So these are the cells with specialization, and some cells without specialization you call it as simple columnar. Now another classification of unilaminar epithelia is pseudostratified. From the word itself, pseudo means false and stratified means in layers. So it is false stratification. That means though it appears to be stratified, it is not actually a multilaminar or stratified epithelium. So just have a look. These cells are almost columnar in shape, isn't it? But we can see that all the cells, the height of the cells are not equal. Some of the cells are small, they are not reaching up to the top, but some of the cells are reaching up to the top. Okay, so because of the difference in height, what happens? You will get the nuclei at different levels. Why? Because nuclei usually occupies the broader region in this type of epithelium. So this type of cell, you can see that the broader part is in the upper part, so the nuclei is there. If you consider the smaller cell, the broader part is here, so the nucleus is there. So ultimately, when you look the entire epithelium, you will be getting nuclei at different level, and this is how you get in a stratified epithelium. So it looks like stratified, but still it is just one single layer of cells, hence you call it as pseudo-stratified. So the nuclei is seen at different levels, and the main important point which you should remember is all the cells, though it is of different height, rest or touches the basement membrane. That is the reason why it is known as unilaminar, because one of the main features of unilaminar epithelium is all the cells should touch the basement membrane, whereas in multilaminar, as you move upwards, the superficial cells won't be able to touch the basement membrane. So in pseudostratified, Why you are calling it as unilaminar? The reason is, though the cells are of different height, though the nuclei lies at different levels, all the cells are in contact with the same basement membrane. And we can also see that so all the cells are not of equal height, and that is the reason why all the cells won't extend throughout the thickness of the epithelium. And basally you can see some small cells, isn't it? So they are actually mitotic in nature. That means these cells will give rise to the cells which are lost. The larger cells will be actually continuously replaced by these small cells which are capable of multiplication or mitotic in nature. Now, where will you get this type of pseudostratified epithelium? You will get it in the auditory tube, the ductus deferens, and in male urethra. Male urethra, you have three parts: prostatic part, membranous part, and penile part. So, in the membranous and penile part, you get the pseudostratified epithelium. And sometimes the pseudostratified epithelium will be having cilia like this. Okay, hair-like projections in order to move the secretions or dust particles or whatever coming on the surface. So such type of pseudostratified ciliated, that is ciliated epithelium, you will get in the trachea and bronchi. So all these examples are favorite questions for the exam. So please do remember. There are many other regions where you get this type of epithelia, but I have selected some of the favorite questions for the examiner and which is easy for you to also to remember as well. So the important ones I have mentioned, please do remember. Now the sensory epithelium is again the epithelium which are specialized for sensory functions, like the olfactory epithelium in the nasal cavity for the olfaction, then gustatory in the oral cavity for the taste receptors, then vestibulocochlear in ear, and in all these regions you will be getting modified sensory cells, the epithelial cells which are modified as sensory receptor cells, and they will be supported by non-receptor cells. So these are the specialized cell epithelia which you call it as sensory epithelia. So I hope you got an overall view about the unilaminar epithelium. In the coming sessions we'll be doing sessions on multilaminar, and we'll be continuing with the topics. So please keep watching, please do subscribe and share among your friends, and please let me know your feedback. Thank you so much.